Health inflation jumped to 30.35% in January 2026, more than double the headline rate of 15.10%, reflecting rising costs for drugs, hospital care, and medical services. This is according to the National Bureau of Statistics. The Consumer Price Index showed the health index climbing from 109.4 points in January 2025 to 142.6 points, while the all items index rose from 110.7 to 127.4 points. Now, despite government measures, including Bola Tinubu's 2024 executive order to reduce drug costs, medicine prices rose 30 to 100%, pushing households, particularly low-income families, to choose between healthcare and basic survival needs. Rising import costs, energy expenses, and inefficiencies in the healthcare system, well, are cited as key drivers. To unpack this, I am joined by Samuel Oyekanmi, Lead Research and Insights, Northern Berger. Thank you so much, Samuel, for joining me today.
Thanks for having me. Good morning.
Good morning to you too. Now, unlike food inflation, which of course has now, printed single digits, we're seeing health inflation still very high and higher than the headline inflation. Talk to us, what's responsible for all this?
Yeah, there are quite a number of things, right? Headline inflation in the first place looks at the general changes in general prices of things across, which involves food, core items and not core items. But when it comes to health, as we see, measures some specific things, right? Things around pharmaceutical products, medical services, dental services, hospital services, parametric services. And you wouldn't expect the headline inflation or food inflation as it were to behave the same way as the health inflation. Headline inflation is somewhere around 15.1%. Health inflation, of course, north of almost 30%, and that's as a result of the weight, of course. Weight for food inflation is somewhere around 40% as of the last recalibration, and then health is somewhere around 6%. But health has some specific factors that impact its prices, the same as food would also have. Initially, before now, we have things around not as much harvest in terms of insecurity impacting food. But for health, right, they're quite niche in how they impact prices. Things around FX volatility. Don't forget that over like the last 2 years, FX changes has pretty much been quite significant, and it has huge impact on input cost for the health services. Things around FX was somewhere around 400 naira. Currently now we've seen some appreciation, but still somewhere around 1,003 to 1,004. That's more than times 3 of where we used to be. And a lot of the materials, machines that is used in these areas are quite FX dependent. So that has been a major impact for that. We've also seen the likes that we continue to import even things around drugs and cost of drugs. We've also had limitations in terms of the number of doctors that we have also in Nigeria. We've lost quite a number of them to the Jabba syndrome. And whenever you have limited supply, of course, what happens is that price is such. And when you look at the MBS data even more critically, you realize that that surge is not just in one region of the country, it's both in the urban and rural areas. So it means as much as the richer people suffer from high cost of healthcare services, the same way those in the urban areas also suffer from. So both urban and rural, and that's quite a mismatch pretty much.
Well, I think the budget composition also sort of, makes it worse, because when you look at what has been allotted to the finance ministry, and a good number of it is for debt servicing, you then ask yourself what happens to infrastructure and other growth or very important sectors, which at the end of the day do not get the needed attention. Moving forward, are you concerned about this, or do you see that, getting solved anytime soon?
I think it's worrisome, because when you look at your inflation baskets, you're dealing with a headline inflation of 15.1. Food is currently single digits. Imported food is also single digits. You're also seeing transportation inflation pretty much mellow down, and a critical area such as health, even as well as education, continue to be hit with significant high inflationary numbers. I think that's quite scary, and it should be something that the federal government and even the Ministry of Health should make a priority, because when healthcare services is not affordable to an average person, what you would have is that you will have high death rates in an economy where you also have a birth rate that is pretty much not so measured, and that's not quite good, really. Life expectancy before now was somewhere around 59 to 60. These days, we don't know where the numbers are, but we envisage that it's even lower considering the level of inappropriateness in terms of our healthcare facilities in Nigeria. So, of course, it is worrisome, and I think federal government and even private sector should also start looking at these areas as a way to find solutions.
You know, earlier you talked about some of the factors that are responsible for this, and I think you also mentioned the fact that there have been, you know, some incentives or an executive order actually from the federal government to address the issue we're having in that sector. But when you look at that sector, there is a whole lot you need to deal with, which you rightly mentioned. How then can we begin to solve these issues? I mean, incentives have been given. We have that particular executive order aimed at ensuring that prices are low, but that isn't happening. So what more needs to be done?
Yeah, well, so for me, whenever I want to look at or come up with recommendations or solutions, I try to look at it also from the problem side of things. If you look at the healthcare services, we mentioned that importation continues to be a major barrier, right? And then we mentioned, like you rightly mentioned, the federal government had made declarations around reducing or taking away taxes on some of those drugs, right? What that has done is it has affected some import part of things. But what about some other cost input areas? Things around cost of electricity, cost of energy, cost of transportation. These are other areas that governments also need to pretty much identify. And I think the fact that we don't have as much patient capital in the healthcare system has also played a huge part. Because one of the solutions would have been to start going through what we call a bulk procurement and pooled purchasing for these healthcare facilities or for these hospitals and pharmaceutical companies. Because what you do, by the time you front load those costs, inflation even at the other end, and also the possibility of FX instability, you would have hedged against that. But of course, we don't have those patient capital to be able to pool those kind of resources. Away from that, we also don't have the storage facility to be able to ensure that when you even do those bulk procurements, you are able to keep them in good condition up until when you need that. And I think that can be a gray area. So we need the capital, we need the infrastructure. Government needs to invest significantly in infrastructure, storage facilities that can help to be able to preserve some of these drugs, especially. Things around energy, I mentioned the fact that high cost of energy has been a major pain. Many of these hospitals and pharmaceuticals companies, of course, rely on high energy, either through the electricity distribution companies in Nigeria, which, of course, if you're in Bangladesh, you know that you're paying significant amounts, right? And that is even not sufficient because you don't have power for 24 hours. And these machines, of course, require constant electricity, which means you have to power them by diesel or some form of alternate form of electricity, and those come at high cost. Again, we don't have, if you want to start incentivizing people to do business in the healthcare sector, you need to start incentivizing some of these specific cost factor that impacts at the end of the day the prices. And I think if you are able to do that, we probably would see some changes. Again, things around clearing also of some of these medical imports at the custom areas also. Government can also try and look at all these areas to fast track some of this import and probably remove some of those duties also on some of the other drugs that, of course, still have tariffs on them. I think those are some of the areas that I could suggest, of course, that we could look at.
Samuel Oyekanmi, Lead Research and Insights Berger, thank you so much for sharing your thoughts with us today.
Thanks for having me.